I'm very excited to work with Hudson Regional Hospital. They've invested tremendously in the field of robotic arm assisted surgery. They have a few different robots at that hospital, and so we're on the same page with respect to staying current, keeping our fingers on the pulse, and offering the latest and greatest technologies in the field of orthopedic surgery and robotic surgery in general. There are types of problems that patients present with that are iatrogenic or caused by the surgeon. When an implant is oversized or overstuffed or put in improperly or malaligned. And that specifically leads to the conversation of why use Mako, why use robotic surgery to basically do a virtual knee replacement before the surgery so you can properly position the hip or knee replacement on a cross-sectional image such as an MRI or CAT scan to optimize position, size, and alignment. Essentially, we see an exact replica of the patient's unique bony anatomy, and before surgery, I can look at that bone in 3 dimensions and spin it around and make sure that that implant fits precisely like a glove. It's very much analogous to some type of product that you're designing or a building. You don't have the contractor just go and build the building without designing it on a computer first, making sure it's perfect, and then executing that plan. Well, believe it or not, in 2019, most orthopedic surgeons around the country are still doing joint replacement surgery in a traditional manner without employing the usage of robotic arm assistance. It's not just about making the cuts. I can also read the soft tissues using the software to make sure that my soft tissue balance and therefore the tension on the medial and lateral collateral ligaments is the same throughout the entire arc of motion. The robot does not allow us to deviate at all from the preoperative design. In fact, if our hand moves even a millimeter or 2 away from the design, the robot will shut off, not allowing us to make the cuts. So it allows for less invasive surgery, which equates to less bleeding, less stiffness, less swelling, less postoperative pain, and a quicker recuperation. The technology is unbelievable.